We've got some breaking news tonight dealing with health care. Welcome back to the Ed Show on MSNBC. Big headline just posted on Huffington Post. The Senate Finance Committee narrowly passed an amendment moments ago from Senator Maria Cantwell of Washington that moves the conservative panel as close as it likely will get to the public health insurance option. It creates a federally funded plan to compete with the private insurance companies. It got the support of Chairman Max Baucus and also the chairman of the Senate Budget Committee, who's on the Senate Finance Committee, Senator Ken Conrad, and passed the committee by only one vote. Senator Maria Cantwell of Washington joins us right now here on the Ed Show. Senator, great to have you with us.
Thank you, Ed.
Give us the detail of this. What was in this amendment that moved Max Baucus and Kent Conrad?
Well, I think, Ed, we hit the sweet spot. That is to say that we are going to provide leverage by giving states the opportunity to opt in, and they are going to do it by negotiating with private insurers. So really you're taking the best of practices that exist today to drive down insurance prices. And when we put that on the table, people saw that that's really what has happened in my state and what we can deliver for Americans.
Well, give us an example. What is happening in your state? Is there one company that has the bulk of the business? Is that what it is?
No, really what happens is because someone, right now, if you think about it, individuals try to go and negotiate with insurers. They're not getting anywhere. And so when you come in with a big population, as we have done in Washington State, and say the state is going to negotiate and you want access to this 100,000 people, you better give us the best price. That kind of negotiations have driven down the price 30 to 40%. So we want to see that same type of leverage used against insurance companies in other parts of the country.
Okay, so this means that we're going to have 50 different scenarios that play out. I mean, states could get in or get out of this option. Is that right?
That's right. And, you know, Ed, I'd like something that's even more robust, but this is what we could get past. But I think what's going to happen is you're going to have both Democrat and Republican governors facing their constituencies saying, you aren't going to negotiate to drive down my insurance costs. I think governors are going to say, my God, if I can drive down the cost of insurance for my state, I'm going to do it.
So all politics is local. In a sense, the Senate Finance Committee wants to put it back to the state legislatures and the governors to duke it out in their own backyard to bring these rates down. Am I reading that correctly?
Well, I could say this, that we have efficient health care and we've driven down the cost. And so I would like us to be more aggressive at the federal level, but at a minimum, I want somebody in that ring fighting on behalf of the consumers to drive down cost. And I think that what we'll see is you'll see many states moving towards this model and being successful at implementing what is a public plan with competitive rates, and will drive prices down.
Now, is each state going to be given some federal money to start this program, and who's going to administer each one of these?
The state administers the program, and we are giving federal dollars to do it. Ed, what I don't like about the underlying bill right now is we were going to give a subsidy to, say, to you or your neighbor or, you know, my neighbor in Seattle. And they were going to take that check as a subsidy to an insurer and say, how much can I get for this and how much will you drop my rates? They aren't going to get anywhere with the insurance companies with their individual check. But now that population bands together, as we do in the state of Washington, and goes to that insurer and says, you want access to my population? What's the best price? And that is what really is going to help us get. We have seen, instead of paying $5,000 or $6,000 for premiums, we've seen individuals only paying $3,000.
So you're convinced that this model will hold premiums in check, so to speak, because there's going to be new competition in the market. How do you think this is going to be received by the insurance industry?
It's going to hold down costs because there's going to be a negotiator who's going to negotiate and demand that the price come down. And I think that, we'll see what the insurance market says.
I thought that's what insurance commissioners were supposed to do.
Well, but if you want access, Ed, if you want access to the market, if you have buyers, how much do you drive down the price of anything if you only have 2 buyers or 50 buyers? Now, if you have tens of thousands of buyers, you're going to drive down cost.
Senator Cantwell, you call it a sweet spot. This is a big break. Could we frame it as that? Do you think this is there's some real movement here?
Well, Ed, I'm a mountain climber, and this is a big mountain to climb, healthcare costs. This is a very good foothold. It's a start, and we need to keep working.
Senator Maria Cantwell, Washington, with us on The Ed Show. Senator, thanks so much for joining us tonight.
Thank you.